Thank you for joining us Friday afternoon. My name is Stephen Beeson, founder of Practicing Excellence, family medicine physician, and host for This Clinical Life, and super psyched today about the role of nursing leadership and our ability to change, transform, and revitalize our care teams and provide supreme quality to the patients that we take care of. And with that, we have Bob Dent, who I've been stalking for some time now in terms of a national thought leader and reading his materials and his blogs and his posts and his YouTubes and his books. But Bob is formerly president at AONL, and we get a little story behind that. Co-author of a fantastic book, The Heart of a Nurse Leader, Values-Based Leadership for Healthcare Organizations, which is 12 leader behaviors that lift those that we lead, and currently CNO at Emory, and helping to make a world a better place, and is now our senior nursing advisor for the Nursing Experience Project at Practicing Excellence, which again, we're super excited about. So Bob, welcome.
Well, thank you. It's good to be here.
Yes, excellent. And so just to get a little bit of interactivity, we've got our chat function. We'd love to hear where you're viewing from, so we can sort of get a sense of where people are broadcasting from over the course of the webinar. So just place in the chat and let us know. I'm from San Diego, broadcasting from San Diego, born and raised. All right, Santa Cruz, got some West Coasters, outstanding. Orlando, Southwest Florida. We got Florida and Santa Cruz, Palo Alto, outstanding. New Mexico, Boston, Illinois, Arizona, Minneapolis, Pennsylvania, outstanding, outstanding. So, Bob, I'm going to begin with a question. It's a very general question. We've heard a lot and experienced a lot and looked at tremendous data and had conversations regarding the state and the nursing industry and what it's been through and undergone. How would you, taking the temperature of the nursing industry right now, how would you characterize that?
That's a good question, Steve. And, I fall back on Charles Dickens in The Tale of Two Cities and his comment, it's the best of times, the worst of times. And so we see in different pockets of the country, where, and even within an organization where nursing is really going very well. There's a lot of good things happening. We're coming out of a pandemic. There's been, a tremendous amount of hurt during over the last 4 years. And there's been a tremendous amount of success in there too. And so there's a lot of opportunity when you think about, where nursing is now. We just have to be able to rise up and be able to see, what's going on around and how to move forward with that.
Right. One of the things I'm curious about and getting your perspective on is, we've heard so much about physician burnout, nurse burnout, and the impact on our capacity to deliver care. Right? And it's rising up to board level and policy level now. Do you think from the executive suite that you have interacted with that there's a legitimate, authentic commitment now to change the work conditions that healthcare workers and nurses and physicians work under to keep and create engagement and retention of clinical talent now, that they're willing to put money behind at source and really get behind as their number one priority? What do you think there's a shift, like we got to do this sort of commitment from executives?
I think there is a big shift in that, and we've seen that organizations have been hiring kind of these chief wellness officers, co-wellness officers, organizations doing a lot around the community resilience model and teaching that, and being able to provide the sort of mental health well-being and resources to our staff at all levels. Creating those psychological safe spaces where people can really talk about what they're feeling, and that's okay. It's okay to not be okay, and be able to work through that. So yeah, there's a huge aspect of that. I know NIH, we got a good friend and colleague, one of my bosses really, Sharon Pappas. but they wrote about joy in the workplace and how to overcome some of this as the pandemic was coming about. And so how do we find that joy in the midst of all the challenges that we're currently facing?
Right. No, it is. And I feel like there's a shift, and it's sort of a, from in every light, there's darkness before light. And the darkness was just a brutal last 3 years that was preceded by an emergence of burnout in nursing and physicians. But through the real despair that the industry has been through, there's this light that is coming, that we can invest and develop and commit to our people so they love coming to work again. And what are the actions that we can take organizationally and as teams and as leaders to allow that garden to grow? So curious about that. So I want to ask a question. You were president of AONL 2018, and you really did some landmark work back then that spoke a lot about the role of and how we see nursing leadership and its role in healthcare improvement. Tell us a little bit about that story.
Yeah, I served a total of 6 years on the AONL board, and as I was coming into the year that I was president in 2018, I think we asked the question in there: are we an exclusive organization, with the title of the organization, the American Organization of Nurse Executives? And it was through those questions and that sense of inquiry and visiting with colleagues around the country who felt like they could not belong to AONE, that AONE and the American Hospital Association hired a third party, focus groups, a lot of surveys, and really got to understand that, yes, AONE was considered an exclusive organization. And so the board at the time in 2018, by the end of the year, we voted on changing the name and had the support from AJ and others to go ahead and change the name from the American Organization of Nurse Executives to the American Organization for Nursing Leadership. And in there, we wrote a driving force that recognizes every nurse a leader. It was that year in 2018 that we have appointed board members. And, at that point, I had a choice in 2017 to appoint somebody to the board, and I chose to appoint a frontline nurse to the AONE board as we were going through these transitions. And so we can hear from our frontline nurses, what is happening, and so we can be grounded in the things that we're doing.
Right. And that's such a watershed event. I mean, you widen the aperture from what AONE sort of stood for and its perception that it was sort of a closed off exclusive group for an industry that has 4.5 million members, providing the majority of American healthcare, right? So, the idea of changing how we're seeing nursing and defining this driving force that every nurse as a leader to me is incredibly exciting. In fact, I was just reading this meta-analysis. It was published in 2016, but I think it's still immensely relevant, which is the power of nursing leadership driving a host of different quality outcomes. Absolutely. And one of them is human engagement. And what they found as the #1 driver of engagement was, I am empowered, enabled to do my best work where I am. Right. And the translation to that is, I'm a leader at the bedside. Not only in my clinical skills and my assessment skills, but my partnership with the care team, my advocacy for patients, my relationship with families and patients. And even when nurses are getting really, really weighted down in workload, if you're working within that context of, I have voice, they're tapping my best, and I have a chance to really have influence over that local environment, that's a precursor to durability, right? And everything that you did. So I'm like really grateful for what you stood for, because I think it has massive downstream implications. So my next question is, every nurse as a leader, empowered to do their best, then how do we adopt that culture So any frontline nurse that we speak to walking to his or her car at the end of a shift in the parking lot to say, do you feel like a leader where you are? My guess is not 100% are going to say yes. I don't know what that number is, but how do we get it so in organizational context, so they feel and they're operating and they have the influence of local enablement where they are?
Yeah, I think there's a lot that can happen in there, and really, when you think about our leaders, in the formal leadership roles, recognizing that they're leaders leading leaders, and so that takes on a whole different context too. So I'm a leader leading leaders. How would I interact with that clinical nurse at the bedside? So that, and then, if something's going to change the practice within that department or nursing, that I'm going to go and talk to them. Now, professional governance is an important part of that, local to the unit that you're working in, to organization-wide professional governance. One of the things that I teach in with my team is that professional governance, similar to every nurse a leader and where they can lead where they are, professional governance happens that way too. It's not sitting around a table. It's if I've got something that came across my inbox, and that I'm coming to you and saying, hey, this just came across my inbox. What do you think about that? And so I'm engaging that nurse one-on-one, or at the teaming station, I'm engaging that team in that moment and document that. Is professional governance in and of itself. And you're allowing that team to be able to step up, and they have that voice that's going to impact their practice or change their practice, that they would have something to be able to offer.
Right. There's, I love this. And my best moments as a clinician, as a leader, was where the people that I reported to asked me for my opinion, my thoughts, and my ideas, and bring your best. They expected a lot of me, but they passed power,
right,
if you will. And it's such a powerful organizational notion. But I have seen that when organizations get a lot of urgency around them, they quickly grab the top-down bullhorn, which diminishes people's capacity to contribute, as opposed to multiplies their engagement and their contribution. And
right.
So it's like we've created this crazy regulatory environment of turn all these boxes green that prompts leaders to do the exact opposite of what unleashes the engagement and creativity of the clinical workforce,
right,
in their discretionary efforts. So it's that paradox. How do you manage those two?
Well, so I just read something maybe 2 weeks ago that 80% of the ideas in the C-suite fail. Coming out of the C-suite, and that 80% of the ideas that come from the unit leader succeed. And if you think about that unit leader, that unit director or others, but if you go even one step further and say that 80% of the frontline nurse, that clinical nurse, if they have ideas, that innovation, the creativity, the workarounds, those kinds of things, and what can be done for that environment, that 80% of those, just think about how much an organization can change if they have that, that sort of a culture of ownership at the unit level.
So if there's multiple differences between our capacity to execute successful change when it emerges and is sourced from the front line, who have much greater wisdom and intelligence and proximity to the challenges, versus barking orders from the top, why don't we use that more frequently? What is the fear, do you think, of the executive team of passing power to the front line to harvest ideas and innovations and creativity and solutions? Why haven't we done that as our operating system and cultures within healthcare?
I think, I think there are, again, pockets, and it's about consistency, right? And so consistency and to be able to do that, and trust, we know that trust is an important part of that, and with that team, and then just, being able to go to them. I think from the top, we see our balanced scorecards, we see all of those things on a regular basis, and we see the reds and greens and that, and we feel like, I've got to do something right now.
Right.
Instead of trust the process that I've got a whole team that can help me with this, and to be able to go to that team to say, hey, here's where we're struggling. What do
Right.
you think? And what are some of the ideas we can get ourselves out of this mess if it's a mess?
It is, and there's a great book called Multipliers by Liz Wiseman. I don't know if you've read that or not, but it's well worth reading, and it's the story of multiplying leaders that multiply the impact of those that they lead, and diminishing leaders. And diminishing leaders micromanage, hover, dictate, and tell, and multipliers query, ask, harvest. And just what the impact is on contribution, outcomes, and engagement. And that idea of becoming a multiplying leader is a skill, just like growth mindset is, or self-awareness is, or compassion is. So as we look at why don't we harvest the ideas and enable local leaders, it's sometimes we don't have the skill. We think the box is red, I better start coming up with bullet points of actions for them to take for us to turn that thing green, because I got to report to my supervisor about what's going to happen. And we just do it all backwards.
I agree. And, and that's perfect, backwards. And that, that sense of, it somewhat drives me nuts in this, when you think about accountability, and that I'm going to have to hold somebody accountable. If I have to hold you accountable to be able to do some of these things, then there's something wrong there. But how do you and I talked not too long ago about accountability and the fact that you can count on me. And so how do we help our teams to say, my name is Bob, I'm working in the surgical unit, you can count on me to be my best whenever I'm delivering care at the bedside, and these patients are going to receive all the education they need, and I'm going to keep the team, those kinds of, that you can count on me to ownership. It's a whole different mindset.
It is, and you've written extensively about the idea of creating ownership, and creating ownership, and I want you to give us some guidance on how we can create ownership locally. How do we develop a sense of ownership and accountability in a sense that people are owning it, that it's sort of a byproduct of the conditions that people work under? Because if they're the recipient of mandates and micromanaged all day, then they're going to be less likely to emerge with, you can count on me.
Right.
They're
afraid.
Right.
Yeah.
There was this data that I had heard from a buddy of mine, Jeff Smith, that I just had a conversation with a little while ago. And he spoke about the number one predictor of engagement of all the data points was people's sense that people have each other's back here. We have each other's back.
Yeah.
And that's a derivative of ownership, right? I love the people that I work with, and we're going to take care of each other. And that happens when we do things like, I'm going to ask you for the best ideas and how you can solve that problem. I will make sure you've got the resources to do so. Right. And so anyway, let's talk a little bit about fostering, there's the idea of local nurses, every nurse is a leader. There's the idea of local ownership and accountability, intrinsic accountability. You can count on me.
Right.
What are the conditions from your angle that we can set within an organizational context that make it most likely that ownership? What are the things that really drive that sense of ownership from your angle?
So there's really, Joe Ty and I, he's a good friend of mine and out of Iowa, and we're actually in the process of doing a third edition of that book, Building a Culture of Ownership in Healthcare. But there are three essential elements of a culture of ownership. One is around being emotionally positive, that I'm going to show up, I'm going to be positive, not going to be engaged in complaining and gossiping and any other of those kinds of things. Cy Wakeman, she wrote her book, No Ego, and she said, workers today spend about 2.5 hours in unproductive time, complaining and doing those kinds of things. And when I think about this whole thought about emotionally positive too, it's also being as a leader, having the emotional intelligence to recognize that when change is happening, it's natural for people to feel angry, frustrated, and others. And so differentiate those who are going through some sort of national emotional change versus those who are constantly in complaining. The second essential element in that culture of ownership is about being self-empowered. I mean, I've got two pieces of art on my wall in my office, and one that's with Florence Nightingale, and underneath that it says "Proceed until apprehended." And so in that being self-empowered, it's allowing people to take that initiative. If it's right, then do it. So it's about taking initiative. And the last is about being fully engaged. So fully engaged in the profession, fully engaged in the Unit-Based Practice Council. I'm going to be fully engaged. I'm going to speak up when things are not right, or that, that I'm going to recognize people who are doing good. So those are really creating that sort of an environment where people can be emotionally positive, self-empowered, and fully engaged.
Right. Right. And so much of what we do in terms of the cues and the interface as a leadership team to our frontline care team members will turn those dials or diminish those dials. But a lot of those are decisions that we can make as a frontline care team member, to be positive and to see the life around us as an amazing opportunity to make a difference. Yeah, I love that. It's fantastic. The other thing that I'm curious about that is a variation of the empowerment is that when we see every nurse as a leader and all the influence that a local leader can have in their clinical environment with their care team members, with their patients, with their families, and with their colleagues, we want to make sure they're doing things that advance culture and performance where they are. Mm-hmm. So what do you see as the role of nursing development as we empower them locally as every nurse's leader? What is the role of human development in that process?
So that's really important to be able to create that culture where that can happen, and people can do, make sure that they're following through on their own learning, growth, and development, and the consistency. You and I, we've talked a little bit, whether it's in conferences or within programs and that sort of thing. There's only so much that a person can take in, and to be able to apply that or even remember it a day or two later. And so really it's going to be about that consistency. So every day, what are we doing? Or every week, what are we doing to really develop our teams around these sort of things? So there's huddles, and so the morning, the shift huddle, to be able to express what's going on there, and letting, as I see in the chat, allowing people to speak during meetings. But it's it's really about not that I'm going to tell you how we're doing today. You have an opportunity to tell us what's going on today and what's working, what's not, and those kinds of things. But really teaching in those moments, 15 minutes at a time, you can make a difference in there. And the rounds, that our leaders do, you're coaching and working with people real time. But it's going to be about those consistency, and that's what I love about the nursing experience project too, is being able to have that library of information that's being pushed on a regular basis for our teams.
It is. It's for my life personally, adopting a continuously learning to advance my capacity to contribute to things that matter. It has become such a core part of my being that it's allowed me to experience and contribute things that I never would if I would have said, when I finish residency, I'm done learning my skills of diagnosing, treating, and patients and issuing treatment plans. But it's the continuous growth of skills to make a difference in life, and essentially to be proud of who you're becoming.
Absolutely
is essential. And all the things that you spoke about, of every nurse as a leader, every physician as a leader, every care team member to be empowered to make a difference regardless of what your role is,
right,
allows us at the end of a work day, at the end of a week, at the end of a month, to put our head down and say, look what I was able to participate in. And I made a difference in something. I mean, it's the best of the human experience. And empowerment's about that. Recognition, continuous growth and development is about that. Which brings us back to the beginning, which is there's beginning to be some light that organizations and leaders can take action to unleash the contribution and the vitality and the intelligence and the contribution of frontline nurses. There's another question I want to ask you, and this is a little bit different in terms of approach, and that is, how do we create, in the context of enormous complexity of what organizations are trying to achieve? It could be a high reliability journey. It can be, their safety initiative. There's new care clinical protocols. There's a new decision support tool. There's a new social determinants of health assessment. There's like all of this stuff, all of which independently is worthy, right? But it creates this sense of there's a lot of burden on me to get through the day and take care of patients. How do we manage the multiple demands on nurses to do important things, as opposed to simplifying things in terms of the kind of care we want to provide to patients and the kind of teammate we want to be? How do we strike a balance? Because I hear everybody talking about all the crap that they got to do, and it's just overwhelming and exhausting.
It is very overwhelming, and especially for our nurse leaders. I had two of my colleagues and nurse leaders at Emory, a unit director, Michelle Kitchens, and then Michelle Pratt. They looked at over time, what was happening with nurse leaders and the demands on them. And nurse leaders have to focus on the whole balance scorecard. It's not like they only have one lane. They have to actually swim in all four lanes if you're looking at it from a pillar perspective. There's two parts that answers maybe, and it's the same one really. But in the 12 core action values that Joe and I wrote about, the heart of a nurse leader and the values-based leadership, core action value number 9 is about focus. And so what is it that I really need to be focused on today? I can tell you on my calendar, for years, I'd have at the beginning of every day, I'd say, what 2 or 3 things do I want to accomplish today, knowing that, your day's packed. And, and I've changed that to what one thing do I really want to get accomplished today? Because there's a lot going on there. And so really that it's about focus. And George McCown in his book, Essentialism, similar sort of concept in which he said, if you've got so many things and you're going in so many different directions, you're not going to go very far at all. If you're focused on that essential piece, you're going to go really far. And so I think that's the struggle, I think, from our C-suite and others. What is the essential thing that we have to come up with? And can we really be challenge each other to say, we've got too much going on. There's only so much. I mean, we can push we talked about that. We can push the metal, to the pedal to the metal in a tank and shoot for magnet or the top core top performance and all of these things. But how much gas is in the tank to get us there? And so that's the delicate balance I think we've got to continue to monitor. And what are those essential things? What do we really need to focus on?
No, I love that layer of interpretation of our chaotic, demanding environment, and to simplify it. And there's some science in sort of in complexity science about the power of simple rules. And if we were to just sprinkle dust across our organizations and say kindness and compassion for every patient every time, and honor and respect for every teammate under all circumstances, and we just did that. And if we did that and embedded that as our operating system and our non-negotiable simple rules, then how many of those downstream things about high reliability, harm events, and all those things that we're independently pursuing, as opposed to coming up with simple governance of these are things that we should be doing under all circumstances. and we will coach them, train them, develop them. They're non-negotiable, and we will defend them. This is who we are. So anyway, I learned so much from you, Bob. You're just, you know, we had a conversation before the webinar, and I learned then, and I learned again now. And I love that Florence Nightingale quote, proceed until apprehended.
Yeah.
There's yeah, that's it, and it's part of that ownership, right? There's another one that from a military leader that said something along the lines of act as though no help is coming. Right. And you know, the ability, and that's in part about empowerment. I feel empowered to take action to accomplish something. And I think there's two things that we covered that are really, really important, because we don't want entropy and anarchy to occur by empowering everybody to do their own thing, right?
Right.
We've got care pathways, we've got evidence-based care, we've got clinical assessments that govern the best practice. Yes, but I think we have to have development of what it means to be a leader. So we're leading in a way that brings the best of the people around us to advance our culture. And we have to have clarity in what our simple rules are. This is what we stand for as an organization. This is our value system that guides me in what I do, what I say, and how I act, and how I make a decision. And I think if you provide that infrastructure context and you empower people locally, because we're willing to pass the power to our local frontline teams, really amazing things are, you know, we can rescue our profession as physicians and nurses and APPs and the rest of care team members who are freaking exhausted right now. So
that we are, yes.
Yes. So Bob, I'm really super grateful to you. I'm so excited about your participation in the Nursing Experience Project and Practicing Excellence and building this mastery journey. How do we continue to grow our capacity to make a difference? To build and unify efforts for people going in the same direction. And you're going to be a great contributor to that body of work, making a difference as you have done and continue to do every single day.
Yeah, so. Thank you. It's an honor to be a part of it. You know, what we're about here is a game changer, and it's going to make a huge difference. I know that for sure.
It's interesting, even in September, I'm hosting a workshop about local leader development and enablement. Because the executive team is like, we need to get these things done. I said, we have to activate and pass the power and enable the local leaders, because that is where culture and engagement occur. Those are local phenomenons. Right. So we have to cascade that down to the front line. So anyway.
Absolutely.
Come to our workshop.
Good. Yeah.
So anyway, grateful to you. For those that were able to join us, we're grateful to you. Keep your head up, take care of each other, make a difference in the world. It's actually better for us than it is for others, with acts of kindness and compassion towards others. There's a lot of darkness and a lot of despair out there. And we need hearts high and eyes wide open to look for people that need a lifting spirit and hand. So we will have this recording available to you next week. It'll go out. We'll slice and dice it a little bit. And if there's anything that you need, you can always reach out to me, Stephen at practicingexcellence.com. Any questions, curiosities, or, you know, I just want to have this problem I want to talk about, whatever. And I know Bob would be available as well, here to help in any way we can to make healthcare better for the communities we serve, our patients and families, and I think most importantly, those providing care. So with that, this clinical life is out, and have a wonderful, safe weekend. Thank you very much.